Well, hello, my name is David Kibler. I'm pastor of Catalyst Christian Church here in Nicholsville, Kentucky. And today's podcast, today's video, we're going to talk with a medical doctor and director of of medical services here in Jessamine County, trying to get some truth about the coronavirus. There's a lot of truth, there's a lot of panic, a lot of fiction, a lot of people that don't know what they're talking about out there right now. So our goal today is simply to get to the bottom, get real scientific information out, people without agendas, about what this virus is and what we need to do. I want to introduce Dr. Ben Kibler, who's also my father. For the purposes of this, I will refer to you as Dr. Kibler this whole time. And Randy Gooch, who's the director of the Jessamine County Medical Health
Jessamine County Health Department.
Health Department. I almost called it Medical Department. Health Department, who's been up to date on this from a social policy standpoint. So, Dr. Kibler, we'll start with you. One of the questions I get is back in, say, 2009, I believe it is when H1N1 swine flu happened. Millions of people infected, tens of thousands of people died. There's no quarantine. Don't you think this is a bit hysterical? That's what I get, and of course, I'm not a doctor. So what's the difference between this and, say, the swine flu or anything like that?
Well, the first thing is that it's a different strain of virus entirely. It's much more infectious, much more easily transmissible, and it has a higher death rate than. The other thing is that because we don't have any natural immunity, it spreads through systems and through cultures very rapidly. We know, and Randy's going to tell you, that the only way to treat this from a public health standpoint is quarantine and mitigation. That's the only way we can affect this without it spreading it forever. The other thing is, because of the burden, it overwhelms the health system more rapidly than these other viruses that we had in the past. Those others last a little while, SARS, MERS, it's nothing like this.
Okay, so what does this virus actually do? Because people are buying toilet paper. Why? It makes no sense. This is not it doesn't cause that. So what does this virus do? Let's get that information out.
The SARS and all that stuff, that was fecal oral. I mean, you had to worry about cleanliness there. That's one thing. But this is strictly by respiratory. This is a droplet infection. Now, what's that mean is that when you spray out, then it goes to other people. Now, we know that this only goes about 3 feet. So that's why there's 3 feet. That's why it's a good idea. Okay. The problem is that it also goes 3 feet and then drops on surfaces. So if it doesn't get you, if you're 3 feet or 6 feet, that's the reason why there's social distancing. But it also lands on surfaces, which then you pick up. And they say that the average person touches their face about 40 times an hour.
40 times an hour.
So, he's doing this, and there it goes right there. So it is a relatively long-lasting particle, and it is from the surfaces that you touch all the time. So that's why it's so important for hand washing, so important for the distancing to take place.
And how long will it'll survive on surfaces for different periods of time? Metal surfaces, maybe 12 hours?
Yeah, it'll last for a while.
Okay.
That's why you got the metal and everything. The hotter it is, the less time it's there.
It doesn't like warm temperature, apparently over 80 degrees. It doesn't like it?
Supposedly, we don't know. We don't know a lot about this particular bug, but it appears from the China experiences
Okay, so it is a virus that attacks the respiratory, attacks the lungs, and that's why it's so lethal. Is that true?
Yes. What happens? It just like any other lung disease. If you have a compromised host, then it gets into your lungs more. But it basically it damages your lungs, sets you up for these what's called super infections with pneumonia, and some people die from the burden of the virus itself, but most people die from the super infections from other diseases, pneumonia, staphylococcus, things like that.
Okay. Now, Randy, there's a lot of anxiety out there, not necessarily from a medical standpoint, but what should we be doing as people, as a community? Your website, which is jessaminehealth.org, is absolutely fantastic. I highly recommend you go there. They've got up-to-date information. Please do that. Jessaminehealth.org is where you can find great information on that. What does a person like me? I'm married. I've got 3 children. I'm a pastor. I interact with a lot of people. I'm an extrovert. This whole social distancing thing is killing me. It really is. It's tough being away from people. What am I supposed to do as a normal citizen to help combat this, to help, as they say, flatten the curve? What as a health director, do you want people in Jessamine County to do?
Well, I would first say that you're correct. It is causing a lot of anxiety, a lot of stress in this day and time, because we're all being asked to do what? Change our behaviors.
Right.
Behaviors that are uncommon to us, that we're not accustomed to, that we're not used to. And we all know when changing behaviors in our day-to-day lives, that's not something that comes natural anyway.
Right.
And, you know, the social distancing is so important. And the biggest reason that the social distancing is important is because there are really no pharmaceutical interventions, no vaccines at this point in time. And we're probably looking at least 12 months before we see a vaccine that's probably going to be able to be utilized for the Covid-19 to be able to treat it comes out. So, you know, we've got that delay. So really the only mitigation that we have right now is this so-called social distancing. And, you know, this social distancing can only be effective if everybody cooperates. You know, if you have social distancing and you're still allowing these large gatherings, large groups coming together, you know, and now I think the federal government is, you know, really recommending no more than 10 people in a gathering at a time. And that's really, really ratcheting down on you know, social distancing and the large
There's some families
gatherings.
in our church that won't be able to eat dinner together.
Right. And you know, I think like Dr. Kibler said, you know, kind of the expectations with some of the modeling is 40 to 50% of the people will get it. And so you can expect...
Wait, say that again. 40 to 50% of Americans are going to get
as
this.
Dr. Kibler,
The best estimate we have at this point in time is that 40 to 50% of the population will be infected. Now, that doesn't mean that they're all going to be sick.
Okay.
It turns out there's a very good rule, 80, 15, 5. It appears that works out across 80%. You don't even know that you have it, but you are a carrier and you can pass it on. 15% will have the symptoms. 5% will have the serious problems.
and I think that that's huge reasoning for the social distancing as well. As he said, 80% of the people will have mild symptoms and maybe asymptomatic and not even know that they're carriers. So that's why the reasons of social distancing are so important, because people are going to be infecting other people and not even realize it, not even know it, not even feel like that they're sick at all.
I'd like to actually make a comment on that because in this day and age, the whole Judeo-Christian concept of respect for the elderly, the honor your father and your mother, that's Judeo-Christian teaching for 3,000 years. That's kind of faded a little bit, I believe. It's kind of in our kind of secular humanistic mindset, the whole respect for the aged, respect for the elderly has kind of been pushed to the side. And I hear a lot of people saying, well, they're just old folks. You know, they're going to die anyway. It's no big deal. Well, that's wrong. That's completely wrong. I mean, as people who, I mean, hopefully I'll be there one of these days. We really need to reestablish this respect for our elders, don't we?
Oh, most definitely.
And so for people like me who are in a very low-risk category, I'm 45 years old, people who are in low-risk categories, for me, still, we have got to be vigilant because we've got parents, we've got grandparents. Some of us still lucky to have grandparents, and we could really affect them.
And
I'm there. I'm in that group.
Yeah, you're 73.
That's right. And the problem with this is that the reason why the young people don't appear to not have much of a burden with this now is because their lungs can handle this burden. As you get older, you have other problems, and then, of course, all the people who have lung disease or have other comorbidities, that's a problem. But old people's lungs can't handle this as well, and our immune systems are not as good. So for some reason, the virus is much more deadly. You know, most flu is young people and old people. Well, this is not the young people. But the problem is that the reservoir for passing this on is the person who can fight this off while it's still in their system, and they can give it to somebody else. That's why it's so very important that, as Randy said, we got to pull together.
And I would say, too, you know, I have a lot of respect for what Governor Bashir and our
I
public
think
health...
he's doing a great job, and I am not a Democrat.
Yeah.
But I think he's
either.
doing a great job.
Me
I really
either,
do.
but from a public health respect, you know, I think that he has pushed politics aside.
I think he
and
has
he's
too.
placing, you know, the lives and the value of people before anything else. And like he says, no matter what the impact of this is on him politically, he wants to feel like that he's doing the right thing and he's protecting the people. That's what his job is right now. And our public health commissioner, I think, has been in his job maybe a month and a half now, Dr. Stephen Stack. And he's doing an exceptional job because I know that he's guiding the governor in this. And, as we're talking about respecting the elderly, you will see those are some of the first provisions that he's made, with restricting visitation and basically shutting visitation down within our long-term care facilities and our nursing homes in those areas, those arenas. We saw in Washington what happened in Washington State.
Yeah.
I mean, basically that outbreak took place initially in a long-term care facility and just devastated much of their population there. And certainly he doesn't want that to happen. And I think when we're talking about social distancing, you'll have a lot of people that ask, oh, don't you think that they're just going crazy with this, that's, they're over-exaggerating it? Some of the science that we have in the past, and we all should learn, from lessons in the past.
Yeah.
And I think a lot of the lessons that we look back at kind of goes back to the Spanish flu back in the 1918, and how devastating that it was. But we saw some examples from different cities, large cities. And I know one example that Dr. Stack has used previously, maybe in the past week as he's talking about flattening the curve, is the difference in how St. Louis responded versus how Pittsburgh responded.
Yeah.
Pittsburgh responded 2 weeks later, okay? St. Louis responded on time, in essence, 2 weeks early. And what they saw was, the estimated death rates, all right, was about half in St. Louis. That's what Pittsburgh was, because they did flatten the curve. They didn't overwhelm their healthcare systems, and that's the main concern right now. If we've got 40 to 50% of the people being infected, as Dr. Kibler has stated, and we see 20% of those are going to need hospital care, it's going to be difficult to care for those people if that all happens at one time. So if we flatten this curve, that spreads it out where our hospital capacity, our healthcare capacity still has the ability to maintain and service these people where hopefully they can.
Because that's the only treatment we have is supportive right now. We have to support the people with the lung problems. However, we do that. If they have the infections, we need to treat them that way, and they need respirators. They may need respiratory care. They may need nutrition. So right now it is supportive. And so we need, those people have to be in a place where they can be supported, which is a hospital situation. Now, we have not reached that here. Fortunately, hopefully we won't.
Pray that we won't.
But in New York City, for example, they're getting close to it now.
And I think that you've seen the response of Governor Beshear. It seems early to folks, but that's what's going to make a difference.
Well, I would keep looking at the website, and there are, 2 or 3 new ones a day. And people say, well, and there's been 1 death, and at the time of this recording, there are 25 infections.
22 was the last count that
22,
I had updated
okay, 22.
yesterday.
22 at the time of this recording. And, you look at that and say, well, why are we freaking out? There are 22, there were 78 flu infections just in 1 day, but now there are 22 since March 1st and 1 death. But people don't realize that's what we want. That's what we want. And I remember you telling me something, Randy, that the problem is that let's say we implement all of these measures. Let's say that, churches go completely online, which we're going to do this weekend. Gathering, restaurants and bars are closed down and everything like that, and nobody gets sick. There will always be people that will say, well, see, look how stupid that was. Nobody got sick. And what you told me was we can never tell who we prevented. We can never count those numbers.
Yeah, we can count the number that died.
Right,
but
right.
we can't count the number of lives that were saved.
Exactly.
What we can do is look at what state of Washington. We know what could have happened.
Right,
if
right.
we didn't do it the right way here.
Right.
And there's, once again, that if you save this one, remember, every person has the capability of infecting 4 other people.
Okay, so let's talk numbers. So somebody like me has the potential. I have a 50% chance of getting it, right? That's about what the numbers are.
Correct.
And I have the potential to infect 4 other people, maybe outside my family or inside whatever. I mean, if I'm living in a house, if somebody in the house gets it, they're going to get it, just no matter how many times you wash your hands. So what that 80, 15, 5. Okay, so 80% of people think they're going to have a cold. That's
no,
what
80% may not even know it.
Okay, all right.
The 15%
15 will know it.
Get the symptoms of the flu. Now, remember, though, these are different symptoms.
So I'm going to do some numbers while you're talking.
Okay, so of the 15% that get it, and remember that these are not flu symptoms. These are not the runny nose and the diarrhea or anything like that, the muscle aches. It's not that. It's high fever and respiratory, the cough, the
So-
deep cough. So those are the
15% of Americans that you're saying are going to see this.
Well, 15% of the people who are infected.
Okay, so potentially 52,500,000 people. If that's 15% of 350 million.
50%. Well, 15%.
Oh, okay, so okay.
15% of 50%.
So 26,250,000 people. Okay, so 350 million divided by 2. Okay, and 5% are going to die.
Well, 5%. No, 5% are going to get really sick.
Okay, so that's 8,750,000 people.
Those are the kind of the numbers that you can play with. And that's really bad because, what's the bed capacity of all the hospitals in the United States in ICUs?
Is it 8 million?
I don't know. I don't know what it is, Randy. You know what it is?
I have no idea.
Yeah, but it's a lot, but probably not that much.
Okay, and so we're talking significant numbers here. And if we don't do, if we just kind of throw caution to the wind, we're looking at some significant numbers of people infection. So that's why this is so important. First of all, to get this information out to people, and second, for us to actually do it. One of the
I think
questions,
some of the modeling, if you wouldn't mind,
Sure.
when you're talking about those kind of numbers, some of the modeling that I've seen in the past show that without any non-pharmaceutical interventions like the social distancing that's being done throughout our state now, without doing that the actual number impacted or affected will be 10 times more
Yes, and there's no
than
doubt
with
about
the
that.
social
so
distancing.
you're looking at 80 million as opposed to 8 million.
Well, we could be looking at with these non-pharmaceutical interventions, we could be looking at 10% of that 8 million that you're talking about. Maybe that's where we're looking at, because if you're looking at it basically with no
Right.
social intervention.
Okay. So that's why we really need to take this seriously.
Sure.
And so the question, I guess, for both of you, what are you guys personally doing? If you want to really know what a pastor believes, look what he does in his own life. If pastor believes that missions is important, if he's not going on missions, it's not important. This kind of thing.
Right.
So what do two people who, a doctor and a public health professional, what are you personally doing to implement these things in your lives? What are you doing? Let's start with you, Dr. Kibler.
Okay, first of all, as I am really paying attention to what the Dr. Fauci and Vice President Pence, their daily briefings now, Governor Beshear, because they're giving you the exact information. And then I am following what they say. If they say don't go to bars and restaurants, well, I don't go to bar anyway, but restaurants, I don't go. If they say social distancing, well, I don't like it, but that's the way it is. However, I am keeping myself in as good shape as I can.
Okay.
I am getting sleep.
That's
getting
actually,
exercise.
I'm glad you said that. Sleep.
Self-care.
As a father, you all are all fathers. When did your kids get sick? When you didn't get enough sleep,
That's right.
right?
So-
It seems like a no-brainer, but that is important, isn't it?
Self-care.
Recovery. So sleep and exercise and nutrition and fluids.
Okay.
As a doctor, I am still, the Lexington Clinic is still open. We are washing our hands, we're washing all our surfaces down, we're implementing, every person comes in, gets the temperature check, we have a lot of screening, so we're very careful about that. We are implementing every one of the recommendations that Randy and his people have talked about our facility. So we're doing all that ourselves. I have canceled several trips, several meetings, just because it's not the right thing to do. I have established some social networks with some of my friends around the country, so we don't meet each other in meetings, but we're still talking. So we're still having some kind of psychological impact. And main thing I'm doing is I'm not being panicked about this. I mean, you got to be rational, but you got to believe that this is a real thing, and you got to be part of America. You talk about Buffalo, Boston, all these places, Boston strong, Houston strong after these big emergencies. This is the time to be America strong.
Okay.
We pull together against a common enemy, and as Beshear says, Pence says, this is going to pass. It's going to be about another 8 weeks. It's going to pass. So let's just suck it up and do the right thing as a a productive member of society at this point in time.
Okay. So, Rand, what are you doing?
Well, I mean, obviously doing a lot of the same things that Dr. Kibler is talking about, and making sure that we create social distancing in our workplace. We've got to be the leader in this. We're looking at implementing what we call our continuity of operations plan, where we're just kind of going to our essential services that we need to provide, those types of services that we can't necessarily provide online, telephonically, or things of that nature. We're still trying to do those, but do them in a way where we're protecting our employees and trying to keep that social distancing. One thing that I'm doing is I'm trying to make sure that I watch the governor's update every day.
Okay.
I have to say
So y'all
that
would recommend that for just the average
listen,
folks?
Those guys are right. I mean, you get a lot of junk on the media, but these guys are right.
And that's the other thing. I watch Governor Beshear's press conference every day, and the great thing about his risk communication is it may seem tedious, but he's going over these items every day. Every day. That way, if somebody's watching this for the first time, they're basically going to hear what he said for the first time, and then all of the things that he's implementing. And for my own self-care, I'm not looking at a lot of the media other than that. Okay, I'm keeping up
That's
with...
a good idea in general, isn't it?
Yeah, because it does create a lot of anxiety and a lot of stress, and quite frankly, I just don't have time with responding to what we're trying to plan for. I don't have a lot of time for that. So, I'm keeping updated with his press conferences, which everybody can find a link to his press conferences on our jessamynhealth.org website.
Okay.
We've got that on there now, so they can go see the latest one. By the way, he's doing those every day now at 5 p.m.
Okay.
So daily updates. He's done a fantastic job with the risk communication on this. I'm also just following the CDC and the WHO, the World Health Organization, just to kind of see what's going on with those experts. I mean, that's where we're getting our expert information from, and that's who we have to rely upon. We can look at a lot of this modeling and a lot of this things that's coming over the media all day long. But like Dr. Kibler said, this is, even though it's in the family of coronaviruses, it's a new virus, a new disease that we're dealing with, and we don't know a whole lot about it. So they're trying to move very quickly to figure out what solutions, what pharmaceutical interventions are for those. But, that self-care, trying to get enough sleep, trying to, look at my nutrition, but also following the recommendations that the governor is setting out for us. Because like I said, if we don't do those, if we don't lead by example, and unfortunately, if he doesn't go to the degree that he has with basically shutting down restaurants, bars, except for the drive-through, the takeout, the delivery, unfortunately, people are going to continue to go. You can make recommendations all day long. Until you make restrictions, you're not going to get action.
Yeah.
So it's unfortunate that you have to go to that degree, but he saw that last weekend with recommendations. People are out everywhere. They're out everywhere. And we can still be out in the environment doing the things that we need to do, but we have to be conscientious. We have to understand what that social distancing is, and we really recommend 6 feet just to give you that protective barrier, even though maybe you're not projecting, but we are. We're recommending that 6 feet. Gives you that protective barrier that we need.
We've got about 5 minutes left here. What do you think? How long will this social distancing take place? And when do you think, realistically, life will get back to normal, if it ever does?
Well, once again, the best estimates at this point in time, based on what we see about the curves going on of new cases in the United States and from the history in China, is that we've probably got about another 8 weeks of this from the middle of March.
So we're looking about the middle of May is when we're going to start.
Well, somewhere around there where this curve will start going down. The idea is we don't want this big spike because it overwhelms the system.
Right.
You may have the same number of people, the area under the curve, but it'll be below the capacity of the system. So about 8 weeks. From a economic standpoint, they say there should be a completely full recovery by fourth quarter of the economy. I think, but in terms of this stuff that we have to worry about, there's probably another 8 weeks is probably the estimate that you have to but some of these things we'll learn will be a pretty good idea. Not a bad idea to do some of these things, and so we may carry on. But then baseball's rumored to be starting again kind of the 1st of June, for example. So,
any closing comments?
Well, and it's hard for me to know with the modeling. Obviously, we'll look and see how the transmission of the disease is going and kind of see when we reach that peak and we start on that downward slope. But hopefully the social distancing that we're doing is going to reduce that peak. And that doesn't mean that we have to continue that social distancing while we're still having transmission, but we can contain it much better, at that point in time if we have reduced that curve, and kept it from spiking itself. But, I just need to encourage everybody to understand that this is real, and history shows us that this is real and that it can be a significant impact on us, and it will be a significant economic impact, and that's going to be unfortunate for a lot of folks. And, certainly I think more so than anything, it's going to be a significant impact on individuals' health and their anxiety and the stress that they're living with daily in life, and hopefully finding ways that they can, meditate. And unfortunately, limiting our church gatherings doesn't help with that either.
Yeah,
and I appreciate
some people live for that.
Yeah, and I mean, I appreciate you all, moving very quickly toward trying to get these services online. Something else that I would ask you, okay, being in the faith-based community and a leader in the faith-based community, maybe there's ways that we can engage the community during this, whether it's hosting weekly webinars, that are maybe prayer services or whatever it might be. We might be able to get churches coming together, and that might give individuals out there the opportunity to meditate a little bit at home, listening to, leaders in the community, actually, praying for their healing and praying for, God to, get us past this.
And in addition to that, knowing who to serve. It's in crises like this that the church typically goes, because we're called to pure religion is widows, taking care of widows and orphans. And who are the most vulnerable? Widows, older. And so if people don't have the ability to get out, maybe come together, get a list of people that need supplies, need medicine, we can go serve in that way.
In our community downtown in Lexington, we have formed a committee, and when somebody goes to get groceries, then everybody says, "Hey, what'd you get, mine?" And so they're helping, because this is basically an older community,
Right.
And so we're actually starting to do this right now, to go on trips together and get these things for other people, look for other people.
Definitely, we're looking at the ways for church to serve.
And if I might, just as a closing comment, you bring it up, but what is the second greatest commandment? It's to love your neighbor as yourself, right? And I go back to what Governor Beshear is actually saying on a daily basis. Be a good neighbor. Everybody's overrunning the supermarkets and thinking that they've got to store up stuff for 6 months, like you were talking about toilet paper, like the old adage says, you don't want to be caught with your pants down, right? So everybody wants to have enough toilet paper. But be a good neighbor. Understand that everybody else has needs. Get what you need for the week, get what you need for the 2 weeks, and then go back and get it after that. But, I have to give props to my wife, but I think that this is a good example. There's an older gentleman that lives in our community, and she was getting ready to go to the grocery store yesterday. So she just stopped, knocked on the door. He actually had no idea who she was other than see us walk through the neighborhood. But she said, I was just checking, see if you need anything from the grocery store because I was going.
Amen.
That's good
and
stuff. I think that's examples of the things that we can do to really help our neighbors.
Well, a very wise person who will remain nameless but happens to be seated at this table told me that people think that tough times build character. They don't. They reveal character. And if you're selfish and greedy, these times have revealed that. And if you are a man or woman of faith and courage, then these times have revealed that too. And so I think what we're seeing is people revealed for who they are right now. And sometimes it's beautiful and sometimes it's pretty ugly. So Dr. Kibler and Randy Gooch, I really appreciate you all being here. If you all have any questions, please email me, dkibler@catalystchristian.net. I will get these questions to these guys. Maybe we can do this again, answer some of your questions. Please feel free to email. That is dkibler@catalystchristian.net. Thank you. Stay healthy. God bless.
Thank you, Dave.
Thank you, Dave.